Okay, if you have read and understood, considering its surgical and administration, kindly tell me, what are you looking at? Which view is it?
Ma'am, this is an image of the sected view of the cubital fossa on the
Very
left
good.
side.
Yes. Can you please tell me the boundaries of the cubital fossa?
The superior lateral border is formed by the brachioradialis, medial border is formed by the pronated teres, and the floor is formed by brachialis and supinata. And the roof is formed by deep fascia.
All right, good. Can you please tell me the contents of the cubital fossa?
The cubital fossa contains the median nerve, the brachial artery, and the biceps tendon.
Yes, good. Right. Can you also tell me the structures which pass through the spiral groove of the humerus?
The radial nerve and the profunda brachial arteries pass through the spiral groove in the humerus.
Okay, can you tell me what would be the clinical features if there is a radial nerve injury at the level of the spiral groove?
If there is a radial nerve injury at the level of spiral groove, the patient will have a claw hand, but the clawing will be a little less in the third and the in the fourth and the fifth finger due to the
Think again.
of the flexor.
Just a second. I'm sorry, I'm interrupting you. You said there'll be injury. The structure which passes is radial nerve, right? So if there is injury in the spiral groove, radial nerve will be injured. Then it will not be the claw hand. Think.
Yes, I'm sorry. Yes. The radial nerve will be injured, and there will be a wrist drop and finger drop, ma'am.
Yes, wrist drop because of
the loss of
paralysis
sensation in the first rupture.
Yes, finger drop and wrist drop, loss of sensation in first web space, and then there'll be paralysis of which muscles?
There will be paralysis of the extensor muscles of the posterior compartment.
Yes, of the wrist and the finger. Very good. Right. Okay, now come back to the image that we were looking at. Can you please identify structures from A to G, please?
Structure A is the median nerve, B is the pronator teres muscle, C is the ulnar artery, E is the brachial artery, F is the biceps tendon of biceps brachii, G is the brachioradialis muscle, D is the cephalic vein, and H is the left radial artery.
Okay. Can you please tell me the course of the basilic vein?
The basilic vein is formed from the dorsal venous network, and it
basilic or cephalic? Okay.
Ascends from the medial dorsal portion of the forearm.
Yes.
And then it runs medially to the biceps brachii muscle, and then it joins the axillary vein and the brachial vein and drains into the axillary vein.
Okay, right, good, thank you. Can you please tell me what type of joint is elbow joint?
Elbow joint is a hinge, synovial hinge joint.
Okay, synovial type of hinge joint. Can you please tell me if there is, just imagine, if there is injury of the median nerve at the level of the elbow, how would the patient present? What will be the deformity and what will be the cause? Yes, please.
Ape-like hand with hyperextension of the metacarpal joint and abduction in the thumb and adduction of the thumb. There will be loss of sensation over the radial 1/3 radial 3.5 skin over the radial 3.5 fingers on the palmar side and the lateral 2/3 of the palmar surface, and on the tip of the and on the dorsal side, the tip of the thumb, index finger, and middle finger.
Okay, this is the deformity in hand. What about in the forearm?
In the forearm, the
yes.
patient will be the pronation will be affected due to the paralysis of pronator teres muscle.
And okay, any other muscle will be affected or will be more like will be given more power to? Ulnar, flexor carpi, ulnaris,
yes,
and
flexor
carpi
there will be
radialis.
yes, ma'am, deviation to the ulnar.
Okay, if we could move forward, can you tell me how many compartments there are in the forearm?
There are 4 compartments in the forearm. It is classified as anterior superficial, anterior deep, posterior superficial, and posterior deep compartment.
Okay, can you tell me what are the muscles in each of the compartments?
Yes, ma'am. In the anterior superficial compartment, flexor digitorum superficialis, palmaris longus, pronator teres, and are present. And in the deep compartment, there is flexor pollicis longus, pronator quadratus, and there's one more muscle there.
And what are their innervations? These muscles are innervated by which nerves?
The muscles are innervated by the median nerve, except the flexor carpi ulnaris and the lateral half of the ulnar half of the flexor digitorum profundus are supplied by the median nerve.
Okay.
In the deep, there is a flexor digitorum profundus, flexor pollicis longus, and pronator quadrat.
All right. Can you please, would you be able to identify the structures in picture A and B as they are marked? 1, 2, and 3. If you can, it's more close to the wrist. If you want to do it today, we can do it. Otherwise, we can do it tomorrow.
Yes, I can do it. The structure which is labeled 1 in the image A is the flexor carpi radialis tendon, and the structure B is the flexor digitorum superficialis tendon, and structure 3 is the flexor carpi ulnaris tendon.
Okay, can you please tell me here in picture B the structures from A to E?
Yes, structure A is the structure B is again the flexor carpi, flexor digitorum superficialis tendons. Structure D is the brachioradialis muscle. Structure E is the median cubital vein. Ma'am, structure C is the biceps brachii muscle.
Okay. All right. If you have to take a blood sample from the cubital fossa, your needle will be piercing which structure from outside to inside?
The skin, the superficial fascia, and the deep fascia.
Okay. If, God forbid, there is a supracondylar fracture of humerus, what are the associated injuries that you will come across?
In the case of supracondylar fracture, there could be injury to the brachial artery, for which we have to look at distal pulses. Yes. If the brachial artery is if affected, it can lead to ischemia of the forearm muscles and cause Volkmann ischemia. There could be radial nerve injury, which could cause wrist drop and finger drop. There could also be a median nerve injury, which may lead to an ape thumb-like deformity and loss of sensation and pronation. Loss of sensation over the lateral 2/3 and pronation.
Okay. These injuries are common in which age group?
In the older age group.
Yes, even in children. And when they occur in children, they are mostly abused. Okay, good. Thank you. In this image, if you could see, right. It's not it, but there is A to, okay, A is the median nerve, it says, left median nerve. B is the left pronator teres muscle. C is a left ulnar artery. D is left sphenic vein. And E is left bicep tendon. Yes.